You're welcome back to the show. This is GH Today. I'm Sewami here. Today is World Arthritis Day, and I'm sure a lot of us do not have enough education on what arthritis is. I'm joined in the studio this morning by Dr. Maame Boatemaa Amissah-Arthur. She's a consultant. What is this your thing called? Rheumatologist. Rheumatologist. Okay. She's a consultant rheumatologist and internal physician. You're welcome. Good morning. And Edmund Lotsu is the head of physiotherapy at Nuffield Clinic. You're welcome too.
Thank you.
Okay, so Doc, what is arthritis in layman's terms?
Thank you very much, and good morning to your cherished viewers. So arthritis in layman's term is essentially joint disease. So arthritis can be broken up into two phrases. Arthro normally means joint, and itis in any medical term will suggest inflammation. So arthritis is any disease that causes inflammation in the joint or causes deformity in the joint. And there are certain things that come as a result of arthritis. We tend to focus on the joints, but it's important to remember that arthritis can also affect the other organs in the body. So there are certain types of arthritis that may affect systemic organs like the heart, like the lungs, the kidneys, the brain. So it's not just the joint disease. And I think that's one of the key things about World Arthritis Day is to raise awareness for patients who have arthritis or people with arthritis, not just for them themselves, but also for their carers and just general education. I'll just give a bit of background about World Arthritis Day. It was started or established in 1996 by the Arthritis and Rheumatism International, and subsequently different patient groups and different healthcare organizations have championed it. And the reason why it's important is arthritis tends to be forgotten. We tend to talk about infection. We tend to talk about now the new phrase of non-communicable diseases, so diabetes, hypertension, etc. But arthritis is probably one of the most common conditions that affects people. And if we look at the numbers, then we'll say that maybe in adults over the age of 45, then up to 1 in 4 people will be affected with arthritis at some point in their life. So, you know, there are 3 of us sitting here. If we add a 4th person, then one of us is likely to get arthritis.
From what age?
So for adults, this kind of looks at adult population. So we say from about 45.
So you don't have young people getting
So
arthritis?
then the next thing to add to that is young people can be affected with arthritis. So historically, or maybe a myth, is that we think arthritis is associated with the elderly, with our grandmothers, our grandfathers, our parents. But we have toddlers, babies. I've managed cases of arthritis in 18-month-old babies, in 2-year-old children, and it goes through the spectrum. So you can have teenagers and young adults developing arthritis as well. It kind of depends on the type of condition that they have. We know that about 30% of adults tend to be in the younger age group, so between the ages of 20 and 40 can go on to develop arthritis as well.
So Adam, what are some of the most common symptoms of arthritis?
Okay, Edmund.
Edmund.
Yes.
Yeah.
So
what did I say, Edward? Forgive me.
So arthritis is normally characterized by pain first, and then swelling in the joints, because it's there are different kinds of it. There's a degenerative type, which has to do with a tearing away or wearing away of the lining of the joint. And then there's the metabolic type, the infectious type, and then the inflammatory type. So you have pain in the joint first. So the joints are like a bone on bone together. So naturally, there's a cushion in between the bones. So when that wears away, then the bone sits on bone, and then it causes pain. Then it also causes some swelling. And then we can have redness, and then we can have stiffness in the joint. And then also we can have something we call functionalisia, which is loss of function. So people cannot perform activities of daily living when they have arthritis.
Okay. And so at what points, you say it's associated with pain, but at what points do you say that I need to speak to a doctor about arthritis because I'm experiencing some pain? What kind of pain, doc?
So what I would say is pain in the joint is not normal. So once you start to develop pain, it is something that should highlight that
so
there may be
joints,
a problem.
I mean, let's be specific. Like
so,
what?
so if we talk about joints, our body is made up of a skeleton, and the skeleton is broken up into different, what we call articulating or moving areas. So you can have the wrist joint, you have the knuckles, anywhere where there's movement or bending, the shoulders, the elbows, the knees, the ankles, the toes, even in the spine. So arthritis is so varied and widespread. We have over 100 different types of arthritic conditions. Commonly, we tend to meet osteoarthritis, which is what Edmund was explaining about, the wearing away of the cartilage in the joint. We may have autoimmune disease, so things like rheumatoid arthritis, where the body is fighting against itself and creating inflammation in the joints. He's talked about gout, infection, etc. The important thing also is to make mention of the fact that arthritis may have systemic features. So what should someone be aware of?
Right.
If they are developing new pain in the joint, which is continuous and progressive, if they are developing pain that comes and goes over a period of time, if they are developing other symptoms in association with the joint pain. So for example, they're feeling very tired, extremely fatigued, and they've not done anything to account for that. They may have rashes on the skin, so a condition like lupus.
Okay.
Cause rashes on the skin.
Okay.
And
I'll
other
come back to
symptoms.
you, Adam. So how is arthritis treated?
So there are different ways to treat it, but the first point of call is usually to go and see your consultant rheumatologist, who Dr. Maame Amissah-Arthur is. So you go see her, they take a sample, aspirate your joint, and then analyze the fluid.
How do they take samples of your joints?
So they use a needle and then enter into the joint and just
Must be
take
very
the fluid.
painful.
If it's yes, that is if it's swollen. They can also do CT scan, MRI, or an X-ray to see the joint integrity. Then they give you medications. But then, most often, because of the loss of function, the pain, and then the swelling, they'll refer you to physiotherapy. That's where I come in. So physio, let me explain a little bit about physio. So physio is just physical medicine. It's just like a doctor who doesn't enter the body and deals with the body outside of it. He knows the muscles, the nerves, and so he knows where to go. The only thing he doesn't do is to prescribe medication or to cut you or to perform surgery. So that's when the physio comes in. So the physio will help with the pain. Sometimes we use transcutaneous electrical nerve stimulation, which is graded electrical waves that we deliver to the body through electrodes, right? And then we also use exercise, we use massage, we use different kinds of modalities, ultrasound, diathermy to relieve pain. And also, you can also have surgery to correct the joint disorder that's associated with arthritis.
Okay.
Yeah.
So as you celebrate World Arthritis Day, what is the one key message that you'd like to put out?
So what I would want to say is 2 myths about arthritis, that it's not only for old people and that younger patients can be affected, or younger people can be affected by arthritis. And the second thing is that beyond the joints, it affects the systemic organs. The key thing about arthritis is that it's largely a silent disease unless you start to show manifestations of swelling and deformities and disability. So a lot of people suffer in silence. They have pain, they have tiredness, they can't move, yet they are expected to go to work, they're expected to go to weddings, to funerals. And what tends to happen is with patients with chronic pain, they start to isolate. And so you can have issues of depression and low mood. You may also have situations where they can't function. So what happens? You are late to work today, tomorrow, the next week. You may be laid off work or you may be asked to retire. So there's a social component of arthritis. Sometimes we may ask patients or carers to look after, so loved ones to look after patients. It means that 1, the patient is not working. 2, somebody who's able-bodied is also not working. So there's also a financial component about arthritis. And so it's important that we learn about it early. Some people also think that once you get arthritis, it means that, oh, I can never walk again. I may become chair-bound in a wheelchair, or I become bed-bound. If the type of arthritis you have is identified early and is managed properly, then the outcome is very good. Yes, we say arthritis has no cure, but it can be managed by some of the modalities that have been discussed. If you have to go on medication, I will also say, please do not go and self-medicate. A lot of patients go to the pharmacy and they buy different sorts of painkillers, and without any medical oversight, that can also cause complications. So early identification, early presentation, you get a diagnosis, treatment is started early, and the quality of life of the patient is extremely, or should I say, is well elevated, such that they can continue work and they can continue to engage in social activities.
Okay. You want to add anything before we go?
So Nuffield Clinic is one of the clinics in the city that is offering very holistic care for people with arthritis. We have a wide array of medical professionals like rheumatologists, family medicine specialists, physiotherapists.
I work there. I do clinics there as well.
Okay.
Yes.
So we are open to see people come around and have treatment for arthritis.
Okay.
Yeah.
Thank you so much.
Thank you very much.
Dr. Maame Boatemaa Amissah-Arthur. She's a consultant rheumatologist and internal physician, and Edmund Senanu is the head of physiotherapy at Nuffield Clinic. How many doctors do you have in your family?
In my family?
Yes.
As in my personal family? One.
Your brother is a doctor, no?
My husband.
Your husband? Oh, it's
Yes,
your husband.
it's my husband.
Ah, he's a doctor.
Yes,
You two are doctors.
yes.
So your kids will be doctors?
And one of them definitely says no. The other one, we will wait and see.
Oh, so that's your husband. I thought it was your brother.
No, it's my husband.
Thank you so much for coming on the show. And thank you for watching. I'll see you same time tomorrow. Have a good morning. I am Sewami here.